Hi, this is Brian and Christina from Your HealthySteps, and our goal is to keep you active, pain-free, and healthy so you can keep on doing the things you love to do, and we do that with foam rolling and self-care training. Yes.
Yep.
Okay, so we are not medical doctors, we are not diagnosing, treating, or prescribing. This is for educational purposes only, and we are giving you our experience from 14 years of doing sports and neuromuscular massage with collegiate, professional, semi-professional, adults, athletes. And today, the grand muscle we're talking about
is the bicep femoris, one of the hammies, or hamstrings. I guess that's a better way to say it.
Yeah. Okay, so you want to tell us where the this bicep femoris is?
Okay, so it's the bicep femoris. So it's one of the largest of the back of the upper leg. And we're going to talk about this muscle because it's fairly important for us as athletes. It is one of three of the hamstrings, so there's actually three hamstrings. And this muscle actually has two heads. So if we look at Mr. Bones here, this muscle, the long head of this muscle, starts right up here at this bone, which is called your sit bone. So if you put your hands just where your upper leg meets your glutes or your buttocks, and you feel that bone right there, that's your sit bone. So that's where these hamstrings are starting from. So this one starts here, runs down the whole entire length of the back of the upper leg, and then attaches right on the bone, right here below the knee, on this small bone called the fibula, and also on the big bone of the lower leg called the tibia. And then that second head, it starts really along the back of the upper bone called the femur, and it runs down also and attaches into the same place as the long head did. So they all come into this portion on the outside part of the knee.
Okay. Excellent. Okay. So what's the action of this muscle? Since it has two heads, I bet it does a lot.
It does an incredible amount, actually. And most of us think of the hamstrings as really bending the knee, right? So the knee gets bent. And it is one of the jobs of this muscle to do, but it also brings the leg backwards. So when you bring the whole leg backwards, that's the hamstrings doing that. And if we think about walking, running, right, the leg goes out, it's the hamstrings that bring it back. Okay, and then this particular muscle actually rotates your hip outwards. So it's going to rotate it this way. And it does the same exact thing when you have a bent knee. It rotates the knee outward. Okay, so that's, what is that, 3 jobs already? Then the other thing that it does, not necessarily a job, but when it's tight, it can actually pull down, or it does, I guess, stabilize the hip by pulling the hip downward. Because it's anchored right there on that sit bone, so it can pull the hip downward.
Okay, so it does a lot.
It does a lot, yes.
Yeah, so how do you know if this muscle is tight on you?
Well, one of the nice things about this muscle is it likes to tell you, and that's by cramps and pain. And so if you're getting hamstring cramps, and they tend to be very, very painful, that's a really good sign that this is really, really tight. You can also have soreness or tightness in the hip or just in the lower back, because the way this thing is pulling down, when it's tight, it actually pulls that hip down. It puts stress on the back. So that's another good way to know it's tight. And then any kind of issue in the knee.
Okay. So, hey, let us know. Have you ever had a painful hamstring?
Either a cramp or unfortunately a tear.
Oh, yeah. So tell us your hamstring experience.
Okay.
Yes.
So one of the things that this muscle can cause when it's really, really tight is stress on the back, the lower back. It can pull your hip. The joke used to be back in the 50s that as as they got older, the rear ends disappeared. And the reason for that is because they were sitting a lot more. They were driving from the suburbs into the city, and they were sitting at work. And so that caused the hamstrings to get tight, and the rear end would disappear. Now we're seeing that more with men and women, because men and women are driving more and they're sitting more. So again, the more you sit, the tighter the hamstrings get, the more pull it will be on the hamstring or on the hip. You can also really affect the mobility of the knee, causing it to be difficult to stand up when you sit a lot. And in sitting, people who drive long distances, say like on vacation, will complain that the back of their leg just aches and throbs, and they only drive maybe an hour to 2 hours, and they got to get out of the car and walk around. It's because their hamstrings are way too tight.
Right.
Okay.
Yeah, we've heard that complaint from
A
clients a lot, and they
yeah.
end up. I remember one guy, he took a soda can,
Yeah.
right? And he was shoving a soda can. He was sitting on the soda can because it was the only way that he was able to stay in the car. Yep.
And how annoying is that you've got, you know, a 12-hour drive, and every hour, I mean, and it is good to stop every now and then and get out of the car, but you know, if you're stopping every hour, you're not getting anywhere.
Right.
Right.
Okay.
But that pain can be so bad, and I've actually experienced it. It's very uncomfortable.
Yeah.
You don't want to be sitting in the car for long hours. So
Okay.
that's telling you it's time to get this loosened up.
Yeah. So now you know if you're dealing with this, you know it's your hammy,
That's
and we can help you loosen that up for sure.
Yeah,
Yes.
absolutely.
Okay.
And some other things that this muscle does is when it has hyper irritated points in it, is it has very unique pain patterns. So you would think if this muscle was angry, the pain would be where the muscle is.
Right.
And you can experience that kind of pain, but you can also experience pain in the rear end, and you can experience pain above and below the knee, even into the top portion of the calf muscle and on the side of the knee. So when it gets, if there's hyper irritated points in there, that it will refer pain outside of where the muscle actually is.
Yeah. So you think you're having calf
issues or hip issues, and you can also have lower back pain.
It's your hammy. Okay. What else? Okay. So what are some sports that really focus on using this muscle?
Well, typically, if you look that up, you would see things like sprinting, football, swimming, basketball is another one. But think about the hamstrings are really a big important muscle when it comes to walking, that gait or running, right? So it brings the leg. So when the leg is going outward when you're walking and running, it's the hamstrings that pull it back. So if you think about any sport that's doing that movement, is going to impact. It's going to be impacted if your hamstrings are tight.
Right.
Yeah.
Right. Okay. Yes. And then so what do you show your clients who come in with these tight hamstrings?
Well, unfortunately, some hamstrings really just need a professional getting in there and tearing some of the stuff out, especially if you've had tears or multiple tears. If it's just tightness, we start them off with foam rolling, but we quickly move them into other self-care tools that are much more aggressive, because the way this muscle runs across the body, it's not going right along the big bone. So a lot of muscles, when they're on the bone, you can get to them really quickly with a foam roller. But this one, because there's a lot of space out here, you need much more aggressive tools to get deeper and deeper into the muscle. And again, the hamstrings have a lot of tendon material, so that also requires some aggressive work.
Yeah.
So that's what we teach them.
Okay, well, wonderful. So we want to make sure that you get notifications of our Facebook Lives, right?
Absolutely.
On Your Healthy Steps. So make sure you go to our Facebook page and you follow us. So every time we go live, you get a notification, and that will allow you to interact, ask us questions, and
Absolutely.
then if you're asking us questions, we can answer them for you then and there.
Absolutely.
And help you out. For sure. So, make sure you do that.
Yeah, because our goal is to get you out and get you out to being active or keep you being active.
Yeah.
And this stuff right here can take you right out of the sport or activity that you like to do. This will sideline you, and that's no fun. It's just not fun.
Okay.
Okay.
We'll keep doing it.
All right. Fantastic.
Okay. Bye-bye.
All right. Take care.